multimorbidity or multiple diseases. Some of the things we commonly are consulted for or are seen for is dementia, also falls. Bone health is something that also goes up there, and frailty. So, things that have, a multifaceted approach. That's generally what, as geriatricians, that we tend to focus on, is a lot of different issues that could be contributing to health issues and health needs.
Falls are the leading cause of injuries that land seniors in the hospital, according to a 2019 report from the Canadian Institute for Health Information. The data collected from participating hospitals across the country shows that roughly 138,000 people aged 65 and older were hospitalized for injuries between April 1st, 2017 and March 31st, 2018. 81% were hurt in a fall. Dr. Gardhouse says the fall is the first clue that something else may be wrong.
There's upwards of 400 risk factors for falls. I like to break it down to things that we're sort of in control of and things that we're not in control of. So things that are intrinsic to us that put us at risk for falls would be sort of chronic health conditions like osteoarthritis, like having had a stroke, like dementia or memory loss. But things that are outside of us that we can probably better control are things like medications we're taking for our diseases, things like alcohol use, and things like the environment. So making sure that everything within the home is nice and safe is key. And we have wonderful colleagues in the occupational and physiotherapy fields that can provide recommendations regarding home safety and environmental safety.
Falls are often caused by immobility and not enough activity. According to Stats Canada, only 14% of adults aged 65 to 79 are meeting the Canadian guidelines of 150 minutes of moderate to vigorous physical activity a week. Being sedentary increases the older adult's chances of requiring assistance for daily living. It also increases the chances of falls.
First of all, yes, falls is not a normal part of aging, so it's really important to know. Most falls risk factors that are identified are modifiable.
Charlene Wells is a physiotherapist with the North Simcoe Muskoka Specialized Geriatric Services Program, a program offered in partnership with Waypoint Center for Mental Health Care. She says immobility isn't just contributing to the risk of falls, it's also a risk of functional decline.
So functional decline basically translates into a decline in what activities they are able to do, their daily tasks that they're able to do every day. So it could be just mobilizing, it could be transferring, it could be getting dressed, it could be bathing. So those functional activities that we all do in a frail senior, it becomes more complex, more difficult, and you'll see that decline over time, so functional decline. So if you notice the functional decline, I would recommend the first thing to do would maybe discuss that with your primary care provider, just to rule out any acute medical concerns or issues that may have developed. And beyond that, with that person being aware of the problems you're having, they can make the appropriate recommendations and refer you on to the care that's needed, perhaps our program, for example, so we can go in and do our comprehensive geriatric assessment and make the recommendations specific to our findings.
So now that we know the problem, what's the solution?
Exercise is key.
Teresa Hind is a kinesiologist with the North Simcoe Muskoka Specialized Geriatric Services Program, and teaching older adults how to exercise is what she loves.
The idea with us is that we're encouraging everybody to be physically active no matter what, so as much or as little as you can, and then also making sure that you come out to maybe a program. It's never too late to get active, and it's definitely going to have benefits that accumulate for you. Our normal program is the CARE exercise program run through SGS, and it's run in several different locations. It's 2 days a week generally for 2 hours long, so it's something that gives everybody a chance to really come in and be a part of a group, to be active, as well as we do some cognitive training, so to kind of make sure that our brain's getting worked as well.
The exercises are simple and using light movements to help get the blood pumping.
And then we're encouraging things like marching on the spot is great. You can change the speed, you can go wide, you can come in narrow. If people are able, we encourage that they would move their arms as well. So things like raising straight up or back, down, coming out to the side and up as able are some other movements that you could try and do.
For those who want to be active, Dr. Gardhouse says find something that works for you and have fun.
Something else that we often use in clinic, but also sort of in general conversation with folks is that, if you don't use it, you lose it. And so that really speaks and rings true for a lot of folks, that if we're not as active on a day-to-day basis, we're more likely to experience functional decline. So you really have to be very deliberate about getting exercise, about going out there, sort of challenging yourself day to day in order to maintain our strength and endurance as we get older.
And challenging yourself to be more mobile will pay off in your overall physical, mental, and emotional health.
Hi everyone, my name is Dan. I'm an infection control practitioner here at Royal Victoria Regional Health Centre. I'm going to be talking to you today about how to put a mask on and take it off correctly without contaminating yourself in that process. And we're really doing this because it's recommended to wear a non-medical mask anytime you're out at the stores, grocery stores, public transit, those places where you're not able to physically distance yourselves at least 2 meters from another person. So really important to go through these steps correctly to keep you and your family safe. I'm just going to go ahead and first and most important thing is to always make sure you have clean hands when you're bringing them up to your face. We're going to be putting a mask on, so I want to go ahead and wash my hands either with soap and water for 20 seconds at a sink is great. If you don't have access to that, use alcohol-based hand rub and make sure you're using enough that it keeps your hands lathered for at least 15 seconds. So we're going to go ahead and do that now. Okay, so now I've washed my hands for 15 seconds with some alcohol-based hand rub. I'm going to go ahead and pick up my mask, making sure I only touch the ear loops of the mask. And I'm going to lean forward, place this on my face. We're going to hold the nose, stretch it open, and then we've got our mask on. We want to make sure, because we've touched that mask, we go ahead and wash our hands again with soap and water or with alcohol-based hand rub. Once we're coming back from our shopping adventures out there, it's really important to make sure you're not touching your mask while you're out, fidgeting with it, adjusting it. Make sure you keep it on until you're home or somewhere where you can wash your hands once you've handled the mask. So in order to take it off, we want to make sure that we've washed our hands prior to, which I've just done. So we've got clean hands, and we're going to lean forward, and we're going to reach to the ear loops of the mask and just lift that off our face, setting it down on a clean surface. This ensures that we're not touching the outside of the mask that we consider contaminated. And anytime, again, we've just taken that mask off, we want to make sure that we wash our hands again at that point. Always, always, always remember, before you go up to your face with your hands, wash your hands. And after you've been up near your face, touching that mask, you want to make sure that you do that hand hygiene again at that point. Very, very important steps to keep you and your family safe. Just some things that I've seen out grocery shopping that you want to make sure that you're not doing with your mask. Never pull the mask down in order to talk to someone or answer your cell phone, those sorts of things. By doing that, you've touched the outside of your mask that's contaminated, and you're also just tucking it under your chin, which can contaminate you as well. So you want to make sure that you have your mask on at all times. Don't pull your mask off the side in order to take a drink of your coffee or anything. You want to wait till you had time to wash your hands and are in your own environment to do those things. Make sure your mask is covering both your mouth and your nose. If your nose is exposed, it's not going to be giving you any sort of protection there. Once you're at home and you've taken off your mask and performed that hand hygiene, it's very important to make sure that you launder that mask each time you use it. So if you've gone out to the grocery store and you've come home and you need to now wash that mask, make sure you're using warm, hot water. Regular laundry cycle is perfect, or hand wash is great as well. We just want to make sure you're doing that each time that you're using that mask to make sure it's clean. So I've seen people out in the stores wearing gloves when they're out grocery shopping or on public transit, and it's important to remember that gloves aren't a substitute for proper hand hygiene. It's really important that you wash your hands and keep your hands clean, because gloves can give you that false sense of security that you have clean hands, but they can pick things up just like our own hands do, and it's very important that you just make sure that you're washing your hands regularly to keep yourself safe. So as far as wearing these non-medical masks, it's very important that we all do our part to flatten the curve and keep COVID-19 at bay. By all of us wearing these masks, we're going to protect each other, not just yourself. And it's really about all of us in the public doing our part when we're going out to grocery stores and on public transit to make sure that we're not spreading this infection around.
I know it's not Sunday, but I'm going to do a little jazz show for you. So I want everybody to really support your local food banks through these tough times, if you can. And I'm going to play 3 songs that I wrote during this whole thing. One is called Miss Sue, one's called Waltz for Peter, and one's called Timmy. All very special people for me, to me. I'm going to start with Miss Sue. Okay. Here we go. 1, that was Miss Sue. Now I'm going to play a tune called Waltz for Peter. Hard to get that band to stop when they get going, boy. That looping pedal of mine, forgot I was using the wrong looping pedal. So, once again, I hope everybody's doing well out there. And think of your food banks. Sure, these are tough times for everybody, but food banks are always need help. So support your local food banks, and the Barrie Food Bank in particular around here. I'm going to end this little thing with a tune I wrote called Timmy.
since the COVID pandemic started, we are seeing an increase in our domestic violence or intimate partner violence calls, and not all of them are intimate partner. We're getting domestic related calls with family members, siblings, those sort of things. We've seen an increase. If you compare our stats to last year, we've seen roughly 10 more calls in the same time period this year than we saw last year. So again, not huge numbers, but there has been that increase compared to the same time period in 2019. The world has changed a little bit since the pandemic in terms of how we respond to all calls. When those calls are received via 911 or into our communication center, we try to do a bit of a screening or an assessment to educate our officers as to what they're going into. So asking some general questions around, is anybody sick in the home? Has anybody had travel and those sort of things? The standard questions that are going on throughout the province. And then when our officers do attend or when they arrive, they're all equipped with some personal protective equipment. We have masks, gloves, goggles that they wear. We have face shields and gowns in the more serious situations. But typically the officers are trying, we don't want to create a combative or an obstructionist approach. So we're trying to limit the use of that PPE in our first response and just keep a distance, keep a safe distance, maybe invite somebody to step out of the house and have a conversation with us. But obviously with domestic violence calls or other in-progress type calls, that's not as easy to handle. And so our officers are having to don their personal protective equipment and then treat a call as they would any other call, and going into the home, separating the individuals and trying to ensure everybody's safety and then dig into the investigation. Typically, we don't see patterns in domestic violence as sort of repeat calls like we might see with, say, mental health calls or some of the others. Again, when we're going through the time of pandemic, there's a lot of stress in people's lives, whether it's financial and employment stress or, close contact and family stress, where people are trying to teach young children at home or dealing with teenagers, young adults in the home, those sort of things. And then you overlay that with just general mental health concerns for people, mental health issues that people are dealing with that, typically in the past, people have been able to distance themselves or get out for a walk or do some things, and they're not necessarily able to do that. So the anxiety and the stress within the homes is increasing, and we're seeing that not even within domestic violence, but neighborhood disputes and landlord and tenant disputes and those sort of things, where people are again, because of those stressors in their lives, the triggers seem easier to occur, particularly when they've been in isolation or close contact with somebody for greater periods of time. The majority of our calls are what we call verbal, non-primary aggressor domestic situations. So there's, it's whether it's a husband and wife, a father and child, mother and child, whatever the case, but there's lots of verbal confrontation, but no physical confrontation, thankfully. We have had a small percentage of calls involving violence that have resulted in apprehensions or arrests. But most of them are getting, the numbers that I provided to you, typically those calls are non-violent ones. We've measured those against our assault calls from last year. So how many assaults, physical assaults have occurred, and our assaults are actually down compared to the same time period last year. But that's, again, to be expected, because not all assaults are domestic violence related assaults. Those assaults can be confrontations in the community, in liquor establishments, parties, those sort of things, which obviously aren't occurring during this time period. Again, it's quite disturbing when you start looking at somebody being in isolation in their home and how they reach out for help, and how they, everybody has the right to live violence-free and not to live in fear. That's easier said than done when, typically victims of domestic violence, they are able to connect with other people that may see injuries or may have an opportunity to share a story with somebody whether they're taking their child to school or whether they're going into work and those sort of things, which obviously aren't occurring during this time period. So, we've been trying to educate the community, and particularly those that live in those tumultuous environments, that they try and connect, even if it's virtually, with family members on a regular basis, so their loved ones or family members can see changes in their behavior or see changes in their appearances. Even though we're in this time of staying home, we really want neighbors to check on neighbors and family to support family, and it, whether it comes down to texting family when they can and using other devices to try and connect with their family to let them know that they're in fear or that they need help. And we've really purported for many years here in South Simcoe, supporting a neighbor, helping neighbor type approach. Most of our domestic violence calls, a large number of them come from other people calling, neighbors hearing shouting and yelling, and we're really trying to encourage people to still call 911 and let us go and check on the well-being of those people. Our members deal with crisis on a pretty regular basis, whether it's on a day-to-day emergency response basis or just in dealing with people in their hardest times in life. Obviously, it's changed the world, and the anxiety around potentially coming in contact with somebody who's sick has raised a level of anxiety, I would say, within our members. More so maybe the younger, newer officers, because they haven't lived through the experiences that maybe some of the more senior ones have gone through in some previous crises or emergency response type calls. But not taking away anything, our members are used to wearing protective equipment. We always have that PPE with us for any type of call, and try and manage that level of stress and anxiety. The difficulty comes, they also the anxiety that they take home with them, because they come in contact with somebody in the work environment, and then the fear is they're transferring that into their own home environment. So we've really been trying to encourage our officers to use their PPE, to use good hand washing and safe distancing techniques, and thankfully that's occurring in our workplace, and our members have been staying healthy and supporting each other and able to go home feeling comfortable that they've done what they've had to do during that shift by wearing the right equipment. Whether they were in the time of a pandemic or whether just in non-pandemic times, there's lots of resources out there in our community, and whether you feel comfortable calling the police because you don't want your fear of the outcome of that, or whether you reach out to groups like, we have regional domestic assault treatment centers that, have toll-free crisis numbers, or, groups such as Simcoe County Local Immigration Partnership Council has a contact line for new immigrants that may be not understanding what the laws are in this country compared to where they came from, or the Simcoe Muskoka Family Connections, having lots of resources and New Path family counseling services. We really encourage people, if they're feeling those stresses in their lives or feeling any mental anguish, reach out to some of those counseling services. They're the experts in the fields. They can maybe help rebuild something that needs to be rebuilt, or help somebody get through a time that they're struggling with. These are very different times that we're living through, and we all need those supports, whether they're mental health supports or counseling services. They're there for us in the community. We have an incredible 211 service that I think is being underutilized in our community, and people just call 211, ask for some help, ask for some guidance, get connected, and look after each other. That's again, neighbors helping neighbors, families supporting families. Just take care of each other during this difficult time.
So Hospice Aurelia is a community hospice as opposed to a residential hospice. So we've been around for 30 years. We had our 30th birthday last year. And we provide end-of-life services for those who are living with life-limiting illnesses and disease. So we offer caregiver support when we go into the home. There's lots of services attached to that. We have legacy services, documenting loved ones' journeys so that they can leave that legacy to their family and their loved ones. We have bereavement services, which is my program that I'm responsible for. So we offer different things that the community needs. So we have one-on-one supports, all delivered by professionally trained volunteers. So it's peer support as opposed to counselling and therapy. So we have one-on-one, we have 8-week groups, we have a specialised overdose loss group, we have a specialised equine therapy group, and then we have these memorial events that we do now in the springtime, late spring, and then we do one closer to the holidays around December. Right now, due to the provincial legislation, we're not going into people's homes. So all of our services have switched to virtual. So whether that be telephone support or video support over OTN, or we use a secure video conferencing platform for some of our groups. So that does look different, and
I think we were really nervous to start services in this manner because we had to embrace a lot of technology. Our volunteers had to embrace a lot of technology, but it's been a learning curve for everybody, and so far so good. This event, I guess the upside of this event is the weather can't really play a factor this year, and every year we contend with rain or sun, or you can't choose the weather, so that's a bonus. Another bonus is that it's accessible for everybody now. So for people who couldn't make it down to this beautiful plot down here, everybody can, if they have a device, everybody can tune in. So we're asking people to send in photos of their loved ones, and maybe send in a photo of themselves planting a flower or planting a plant, because usually we would come down here and we would plant flowers. The city of Aurelia generously donates the flowers each year, and then we have a ceremony, whether it be here or under the pavilion, and we pause and we take time out and we plant the flowers. So it will be similar to other ceremonies. We will have that ceremonial aspect to it. We will have readings and poetry and music. Then we will have a piece where we show photos of loved ones and have their names scrolling down, and show photos of people planting flowers. But we won't have the interruption, so it will be a live pre-recorded event. The event happens on Thursday, the 18th of June at 6:30 p.m. And you can go to our YouTube channel or our Facebook page to get more information. So between now and then, and hopefully sooner rather than later, so we can compile all the photos, we're asking people to submit their photos either via our Facebook page, or they can send them to me directly, which is just louise@hospiceaurelia.ca, and we will feature them in the ceremony. I think to use a blanket statement and say everybody is grieving right now, that's kind of right, but it's kind of not right, because we're all grieving something, whether it be missed milestones for kids who are supposed to be graduating, right? Everybody's grieving something. We're grieving that we can't just go to the store and shop how we used to, and vacations. Our life just looks different. We're very inconvenienced, right? So we could be grieving or mourning those losses. And we acknowledge those as losses, but the loss of somebody that has died is obviously more significant. So what we found is some people are actually doing okay in their grief. They've had a significant loss, but because the planet has slowed down a little bit, they seem to be rebounding and moving forward. And it's not necessarily a terrible thing that we've slowed down, because if you think about somebody who's had a loss and they want to come to a grief group, so they take that time each week to come out for 2 hours and work on their grief, right? And we're so busy that, that's sometimes all we can afford to do. So I think now some people are doing okay. Yes, some people are really struggling because they can't be with loved ones. So I think it's different and unique for everybody, but I acknowledge that for end of life and for those first few days, if you can't be with somebody, then it is extra tricky.
My role here at the hospital is the quality risk and patient experience management. So what that means is I'm dealing with the needs of the patients, looking at what they need, where there might be some risks, where things need to maybe change according to best practice. So I work with the managers and the patients and all of our staff to make sure that we're doing the best possible for our community and for our patients. We knew that when we started the fight against COVID that we needed to fight for something that was going to work for our patients and the care that the community needed, which now in our kind of unprecedented times, it's care from home. Patients want to stay home. They don't want to come into the hospital, or they're afraid to come into the hospital. So what Meditech Virtual Visits is offering is a platform for our healthcare providers to do the care that you would otherwise see in some of our ambulatory care settings from the comfort of a patient's home. So what this looks like is you're going to call in and you would talk to the booking clerk that's taking care of your appointment. And what we need to know or speak to the physician about is if your situation and the care you need is appropriate for a Meditech virtual visit. We want to make sure that we're targeting the people that it's safe for, the people that can have their appointments from home versus somebody that has to be in person, in-house to see a physician for the care they need. So there are some different distinguishing factors, such as might be wound care, maybe you have a broken bone. Some of those things have to be seen in person. If your appointment is appropriate to be seen as an outpatient virtual visit, what you're going to do is make sure you have our Patient Connect portal. And to get that, you're going to be either connected through our Health Information Management Department, where they will walk you through signing up for the portal, or you can access our website at stevensonhospital.ca, and there you can find the instructions on how to get in contact with our health records, Health Information Department, where they will also walk you through again how to get on. Once you have the Patient Connect portal, it's fairly simple. The booking clerk taking care of your appointment will book a virtual visit. And what it does is it populates right into the portal. And it's as simple as clicking join on the booking that you see populate. And that will take you into a virtual visit, much like you and I are having right now. It's giving us the opportunity to minimize the traffic coming through the hospital, which is mitigating the risk of contracting COVID and any other illnesses out there, the primary risk right now being COVID. Just lower traffic mitigates that risk, keeps everybody safe, patients, staff, everybody that's working here. So or accessing the facility. So yes, it's absolutely creating that, but it also, on the flip side of that, makes sure that those needing the care are getting the care they need at home in the community, because we certainly don't want patients at home needing care and not getting what they need and becoming even more sick. So we do want people accessing the care, whether it be the emergency department, whether that be our ambulatory care, whether that's mental health, whether it's virtual or in person. We certainly want people getting the care that they need. Well, in patient experience and the quality and risk side, we're always looking at improvement initiatives. So year by year, we have projects running all the time improving. Something of this grand kind of rollout, this grand of a rollout is huge, and it's big because of the times. I think given a longer stretch of time, we would have gone to virtual solutions regardless, but the pandemic has certainly pushed the need a little more quickly and has challenged us to get things up and running as quick as possible. So it's certainly an honor to be part of something that is so big, and I think it's going to change how healthcare is delivered. And I think virtual visits are a thing of the future that we're not going to see an end to.
MediFarm Labs is a concentrate-only cannabis manufacturer. We're a medical-first company, and we provide cannabis to patients and customers all over the world. MediFarm Labs was founded in 2015 in Barrie. And we were licensed by Health Canada in 2018. It's actually quite a long process. And then in October 2018, we actually launched our public company on the TSX. We're actually the only company in Barrie that's headquartered in Barrie that's publicly listed. Barrie was an obvious choice for a lot of reasons. It helps that myself and the other co-founders are from the area. So obviously there's that hometown feel that's always great. But for us, Barrie was a lot of things. One, we got a lot of support from local government at all levels, at the federal, provincial, and municipal level. When we first started business in 2015, there's a lot of stigma still around cannabis, so it's important to have that support. Also, access to talent. There's a lot of great people that live in Barrie. We staff over 160 people here in Barrie, so having access to that talent is great. And then even beyond that, just close proximity to Highway 400 and the infrastructure that was already in this industrial zone really helps our business a lot. So right up until we got our license, we were probably only a team of about 6 or 8 people. So if you think about that, we got our license March 2018. We're a team of 6 people. A lot of us in the founding group, obviously not taking a salary and just building that business and getting ready for that licensing. Once we're licensed, that's when it really took off. So even in the last year alone, increasing our staff by over 100 people is been rapid growth for us here at MediFarm and in the whole industry. Because we're a medical first company and we do serve patients, we don't see as much of the stigma now that we're operational. So it helps that, we are helping a patient base and helping treat different indications. One of our biggest customers is Shoppers Drug Mart. So obviously that helps legitimize our business in many different ways and does help with that stigma. We try to stay involved as much as we can in different aspects of the community so we don't look like we're just like a fly-by-night company. Obviously being publicly listed and keeping Barrie as our home base helps with that as well. COVID has been it's a very unfortunate situation, but it's caused us to have to find some flexibility in our business. As a manufacturer, we are deemed essential from the beginning, but obviously we limited a lot of the scope of what we're doing to make sure it was for essential. So whereas we used to do a lot of visitors and tours and whatnot with potential customers or international regulators, all those have been put on hold. We only have essential visitors here at our Barrie facility. We have each person working at home that can work from home. So if you think about our staff in departments like marketing or accounting and different desk type jobs that they could do from home, they'll do as much from home as they can. And we still have our production staff coming in each day, but we've staggered their shifts to limit their exposure to each other. So where we have 3 shifts, days, afternoons, and weekends, those shifts won't actually interact. That way we mitigate any risk of any carryover if there was an incident here. So just some different things like that. Obviously, as the provincial guidelines and the federal guidelines change, we adhere to those. So we do employee screening every day as people come in. They take a quick questionnaire to make sure that they have no new symptoms and other, provincial recommendations. As far as production goes and product that goes out the door, we're pretty much the same. We had, obviously hiccups in the supply chain. Some of our suppliers and customers obviously weren't prepared for COVID and the unfortunate situation as well. So it remained us to be flexible a little bit in production, but all in all has been, production as usual in actual end products getting off the production line. We haven't had any COVID-related layoffs at our business today. We did have some people that maybe weren't able to come to work because they're in a more high-risk situation of themselves or someone at home. So we were a little bit short-staffed for that reason. But as far as taking a big financial impact to the business and having to slow down our ability to hire or buy supplies, we didn't have that effect, luckily. Probably the best place to start is on our website, MediFarmLabs.com. On there, you could find a lot of stuff about ourselves. We have a blog about, the process of extraction itself. It's a very interesting process, and post-COVID, we'd love to have you in the facility. And on there, you can also find, different information about the history of our company and investing in our public company.
So we saw a viral video on Facebook of a couple people in the States bringing their horses to some retirement homes. And one of my clients sent me the video on Facebook and said, wow, this is such an amazing idea. So I shot off about 10 emails to some local retirement homes, Aurelia, Midland, Barrie, and asked them whether that's something that we can do during COVID and whether that's something they would be interested in. And within an hour, I had people emailing back, this is such an awesome idea. We would love to have you out. Can you come this week? Can you come next week? So we set up a schedule. We started, right now we're up to 7 homes that we've gone to, and we have a couple more in June. And we're taking the horses, visiting outside all the residents through their windows so they can see the horses. Some of them we've even been able to talk through the windows so they can ask questions about the horses, tell us about some horses that they've had, and they really get a kick out of it. The smiles are awesome. And we even went to the Bob Rumble home for the deaf in Barrie, and we got to sign through the windows, and they taught us a bit of sign so that we could tell them about the horses, they could ask us questions about the horses, so that was such an awesome experience. So right now, it's me and my twin sister that run the riding program here at Dream Valley, as well as our long-term client, Kristen, and her 2 daughters that come with us with their horse, Sierra, and Caitlin's horse, Salvador, who's a rescue pony. So he's really good with people as well as with Sierra. She's a super, super emotional horse, so she loves being around people. And right now we weren't operating with lessons, so the horses were really, really missing the social interaction. So we put them on the trailer, head out for an afternoon, hit 1 or 2 homes, And it's a really good lesson for the kids to learn how to give back as well as for us. It gives us something positive to be doing during this crazy time. These two are actually really good at hopping on and going wherever we ask them to. They are show ponies, so they like getting on the trailer and doing their job. It has been a bit of work, but honestly, it's all worth it when you get there and you have this overwhelming sense of positivity and joy because you see how much it means to the residents. And it's honestly been really fun to go with the kids, and you smile the rest of the day. So it's brought up our spirits just as much as it's brought up all the spirits of the residents. The response has been so much more than I could have ever hoped for. I shot off a couple emails thinking like maybe one place will let us do this, and we got such a big response. And even after reaching out, being in the paper a couple times, more places have reached out to us and asked us to come back to come to their retirement homes. The feedback has been super positive, and to be able to go and see what it means to the residents just makes us want to do it more, and to bring some of our lesson kids maybe next month so more kids can see how simple something like bringing your horse is to those people that are in kind of a stuck situation. And it's something that, we hop on a trailer and go to a show once a month and it's no big deal to us, but for them, it is a really big deal. So teaching the kids that is really important for us. We are taking on more homes to visit later in the month. We're giving the horses a bit of a break because we are starting back with our lessons again. So they will be a little bit busier, but it's something that we would like to continue to do throughout the summer and bring more of our kids with us so that they can, learn about community outreach and how easy it is to do something kind for someone else. And we'd really like to thank everyone that has had us so far, to my mom who runs the facility for letting us bring our ponies and ship out of the farm whenever it's necessary, and to all the students that couldn't come with us but made signs and artwork for us to take to the residents. It's really been a communal effort from all of the family here at Dream Valley, so we're really thankful for everyone that has made this opportunity so awesome.
At Deafblind Ontario Services, we provide accessible residential and customized support services for individuals who are deafblind. Deafblindness is a combination of hearing and vision loss that is unique to each individual, and so they require customized support that is tailored to that unique need. Our interveners provide that support. They act as the eyes and ears of the individual who is deafblind through the sense of touch. So they really bring the community and the world around the person who is deafblind to them through that sense of touch. At Deafblind Ontario Services, we have locations across the province. These are fully accessible, completely customized to the needs of the people that we support, and provide access to intervener services 24/7. The needs of the people we support, again, really vary person to person. Because that level of vision loss and hearing loss is really unique to each individual, they're going to require a different amount of support, just depending. So we have locations all across Ontario. We're located in urban centers and also rural areas, so all across Ontario. And our team of interveners is quite expansive. Again, like I said, we are a 24/7 operation. And that means that we have interveners in each of those locations all day, all the time. Right now, during COVID-19, it's especially a unique situation. Our team of interveners are, of course, a essential service. So they are working day in and day out with the people that we support who are deafblind, providing support to them even during these challenging times. So they are bringing every day to the table their passion, their collaboration, their leadership. They're coming to work and they're making the most of these current circumstances during COVID-19, really uplifting the spirits of the people we support, and trying to bring interactions to the locations. So an example of that is for someone who is deafblind, maybe they don't necessarily know during this time why they can't go to Tim Hortons on a Monday for their favorite coffee like they're used to. And that routine and consistency is really important to them. Our team of interveners, we've seen them, bring Tim Hortons to those people who really rely on that. It really makes their day. And they've just done such an amazing job. touch is very important to someone who is deafblind. That is a huge part of the way that they communicate, and the way that we really enrich their lives and increase their independence is through touch. So even during COVID-19, when we're looking at social distancing, touch is still very important. We have measures in place at all of our locations across the province. So we're keeping in mind, the recommendations of public health authorities, but also the fact that for the people we support, touch really is that communication. So we have things in place like universal precautions, extra hand sanitizing, hand washing, routine cleaning between interactions. But that level of engagement through touch will always be very important for the people that we support. That digital element or online conversation has been a huge way to bring people together. And for a lot of the people we support, that is still important to them too. We have some people who are using technology long before COVID-19 arose to communicate with people outside of their location, whether it's their friends, their family, interveners they want to connect with. That interaction is still possible for them, and our interveners do help facilitate that. Well, the public can always reach out to us for ways to support us, either on our website, deafblindontario.com. That will give them lots of opportunities to see how they can get involved, whether that is through donations, maybe in the future volunteering. And again, fundraising events are definitely important to our organization for raising that money that supports the people that we support with deafblindness. So we had initially been planning a fundraising event for June, which has since been postponed until next June. That event is called Wine and Whiskey. But with social distancing in effect and really, looking at these times now and what we're facing, we really needed to get creative to host an event that is similar to the concept we had initially been planning for, and make the most of these current circumstances. We really wanted to bring people together for a good cause and also a great time, which is where the concept of our Finer Senses event, which we're hosting on June 12th, came from. And it's also being hosted during National Deafblind Awareness Month, which takes place every June. During National Deafblind Awareness Month, we really come together with other organizations with a similar mission to our own, supporting people with deafblindness, to really shed light on deafblindness, the accomplishments of these people, really celebrating them. And we're really trying to make a way from coast to coast about deafblindness, really drawing attention to vision and hearing loss when it's combined, and all of the amazing things that these people can accomplish with the right supports in place. The potential of a person with deafblindness really is limitless with the right supports, like intervener services. So during this month, we really aim to shed light on the specialized need for interveners across Canada. About 1% of the population in Canada is deafblind. The role of the intervener really is the eyes and ears of the person with deafblindness through the sense of touch. And this means that they are connecting the person who's deafblind to their community. The people that we support, they are very active in their communities. They like to, do everything that you and I like to do, getting their own groceries, going out for coffee, doing social activities, community outings, working volunteer jobs. So the intervener really helps to increase independence and support those initiatives for the person who is deafblind.
I think it's a really important thing in order to provide people with an opportunity to connect and feel like they are a part of something in a time like this especially. The date of the 2020 Fun Run and Walk is June the 6th to the 14th, and you can participate anywhere in any location. Comparatively, in years past, it's been a one-day event. It's been an event taking place at the Barrie waterfront here, and has attracted somewhere around 1,100 plus people. And it's been a 5-kilometer, 10-kilometer chipped timed race, as well as a walk and a kids race. And this year we've had to pivot and change just a little bit, as everyone else has had to do it in the world. And it has become an online platform. So literally people can log on to the website, register as an individual or a team, so a corporate team or a sports team or a family, and participate together, share successes, share photos and accomplishments there on that platform. So if you go onto the website, you'll see specific routes that are laid out for you. You can choose one of those routes, which is great if you want to be competitive and compare yourself to other times, or you can choose your own route, which is, I think, appropriate for this time, just doing whatever you feel is best for social distancing. In years past, it's been a registration fee, but given the times, we wanted to acknowledge that things are difficult for people in this time. There is no set registration fee for people. It is a pay what you can model. And with that being said, everything goes right back into the community. So donate what you can and just have fun participating. We support projects and initiatives like RVH Hearts and Minds, Nottawasaga Valley Conservation, Barrie Public Library, as well as green spaces, park improvements, and environmental projects as well. The website is www.barriefunrun.com.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
After a night out with your friends, not having a plan for a safe ride home can leave you in a bad spot. You could end up riding in a police car, an ambulance, or a hearse. These unplanned modes of transportation can be a costly choice and do not take you home. Your plan could include a designated driver, a taxi, or public transit. Drink responsibly, choose your ride, and have a plan for a safe ride home.
Visit arrivealive.org to find out more.
Shaggy and Scooby were taken?
Yeah. This blue light came down from the sky and beamed them up. Maybe this can lead us to our culprit. Jinkies!
This isn't about some guy in a rubber mask.
I would have gotten away with this if it weren't for you meddling.
This is about one of us.
This is Rogers TV, Midland.